Open eye, feel the waves cut through me, hypnotized by the sound.
I look like a cafeteria woman. The doctor came in. He can either do the oats procedure or the micro fracture. Which, in terms of recovery, if he does the oats procedure, taking cartilage from one side of the knee to the front, that would mean I would have to be in crutches for 4 weeks. If he does the smaller one, then it'll be a much faster recovery.
Open eye, feel the waves cut through me, hypnotized by the sounds I'm breathing in. Hold tight, chemicals collide. Hold tight, hold tight, hold tight. Dripping lights paint the skies, all because of you. Dripping lights paint the skies, only you can make me feel alive.
Hey guys, today's day 4. Today's October 1st, 2016. I had my knee surgery this past Tuesday. I ended up having a knee arthroscopy with a partial menisectomy. This was all due after a fall I had earlier this year in January. I had recurrent swelling and pain. We tried everything, like all the conservative treatment that we could. Prednisone, we tried cortisone shots. He aspirated fluid from my knee a couple of times. We also tried orthovisc injections, which is like a gel that they use for patients with arthritis. That worked for actually like 2 months, and I was able to, go back and do the things I was doing before the injury. Then it stopped working all of a sudden, and I don't know if I did something wrong or what happened. But anyways, I started having pain and swelling again, so I just decided to go through surgery. The doctor did tell me in the beginning, I'm still young, I'm 35, and the chances were my knee getting better, 60% chance to a 0% of it getting better by itself. I did have an MRI, and on the MRI it showed meniscus and cartilage injury, but not until the day of the surgery that he would go in there and find out exactly what the damage was. He would be able to tell me what my recovery would be like. The surgery was, I think, about an hour long. He did not do the longer procedure, so I was super glad, because the procedure he did, it's going to take less time for me to recover. Right now, I have to use these crutches for about 2 weeks, or 2 or 3 weeks, he said. I can't drive for 3 weeks because it's my right knee, and I'll show you guys how my incision is looking now. I can't drive for 3 weeks. This thing right now is just getting around and not so much the pain. I mean, I try to do things myself. I do need somebody to help me with my meals. I grab a bag and I put it on the end of my crutches, and then I just walk with them like that. Or I put stuff on my teeth. Or we take our mobility for granted so much. Just really, I can't wait to get off these crutches and be myself again. Even though I have to wait 1 year before any running, any jumping, or any type of strenuous activity to my knee. I do have an appointment to see him again on October 12th, which is about almost 2 weeks from now, and he will remove the stitches from my knee. And from there, he'll refer me to physical therapy. But I am super glad, I'm super happy that I decided to take a chance and go through the surgery, because I was miserable, to tell you the truth. When your mobility is taken away, it's devastating, it's depressing. I mean, I couldn't even get on my knees anymore. It was hard to get in and out of the bathtub. Dressing, like putting on my pants, was hard. Let alone like kneeling or squatting down to even look in the refrigerator. That was hard. So, I mean, that's no way of living. So I decided to take a chance, and I'm glad I did. And I know it's gonna get better, and I just have to give it time and rest and do everything my doctor's telling me to. And I know it's gonna get better, but it's just gonna take time. So this is my right leg. I did have a bigger bandage on the day of the surgery. He removed it the day after on my post-op appointment, and he put some clear bandage on, and there's also some steri strips, and there's stitches on there. He has his signature right there. He did that on the day of the surgery, so everybody would know that this is the leg that they were working with, and nobody would get confused. My knee is just swollen. I've been applying ice and also elevating it a little bit. He told me not to overdo it because he doesn't want me to strain my back either. But this is how it looks like now. Very clean, actually. I didn't have any blood on the bandages or anything, so it's looking good. Good morning, YouTube. Today is Wednesday, October 5th. Yesterday was 1 week after my knee surgery, and everything's going great so far. I mean, I haven't had that much pain. It's great. I can't wait to get off my crutches. So I just want to talk to you guys about my usual routine when I get up in the morning. I get up really early. I do my bed, believe it or not. I make my own bed. Just hop around in one leg. And my balance is getting so good, so that's a good thing too. But these are the exercises that he's been telling me to do, which are lift, just these right here. Should practice with my straighten it. It's not painful at all, so it's good. It actually feels good to stretch those muscles. So every morning I get up. As you can see here, I am having a hard time maneuvering my crutches, and that is because they were not adjusted correctly to my height. Make sure that your doctor or physical therapist shows you how to adjust them to your size, so it'll be easier for you to be mobile with them.
Open eye, feel the waves cut through me, hypnotized by the sounds I'm breathing in. Hold tight, chemicals collide. Hold tight, hold tight, hold tight. Dripping.
So it hurts, guys. So I brought in a chair, and I'm gonna cook my chicken while I'm sitting because my leg is really hurting. The way the stitches are. 2 weeks today, post-op appointment. See if the stitches are coming off today or not.
As I'm editing this video, I am about 4 weeks away from being 1 year post-op. I wasn't planning to post this video, but I hope to encourage or motivate someone out there that's debating to have knee surgery. Honestly, the recovery phase was hard. I was off from work for about 6 weeks, and I was on crutches non-weight bearing for about 3 weeks. Pain was not an issue for me the first few days since I was on around-the-clock pain medication for the first 36 hours, then I was weaned off. My knee's still not to its normal baseline. It has significantly improved with time and strengthening exercises. Here you see me back at the gym at around 6 months post-op. I still can't squat, lunge, or run. I'm super thankful for the opportunity that I was given to have the surgery and to get better with my mobility. And as always, thank you so much for watching. Please remember to like, comment, share, and subscribe to my channel. And I'll see you next time.